Hello, and welcome to Siteman Cancer Center at Barnes-Jewish Hospital and Washington University School of Medicine. You are about to take an important step in your patient journey, and you probably have more questions than you can remember to ask. What is the process of stem cell transplant? How will I feel? While watching this video, write down any questions that come to mind so we can answer them during your next appointment. We also recommend that you watch this with family members or other caregivers so they learn more about the process too. By the end of this video, we hope to answer most of your questions. Also, we'd like to show you around Siteman Cancer Center so things are more familiar when you arrive. We are located on the Washington University Medical Campus in the Central West End neighborhood of St. Louis. Our inpatient facility, Parkview Tower, overlooks Forest Park, considered one of the best parks in the nation. We designed the facility around the patient experience to provide the most supportive environment possible. Siteman Cancer Center is a part of Barnes-Jewish Hospital and Washington University School of Medicine, both nationally ranked institutions, and our physicians also are researchers and medical school faculty members. Many of our patients form close bonds with their care providers, including nurses, while at Siteman Cancer Center. Now, we'd like to introduce you to some of the team, the people who will be taking care of you.
We are among the largest marrow and stem cell transplant programs in the world, performing on average nearly 400 transplants a year. Our program provides the best cancer treatments available, both investigational and as standard of care, helping to ensure the best possible outcomes for our patients. Our commitment to world-class research and compassionate patient care provide a winning combination in the fight against cancer.
Stem cell transplant, bone marrow transplant, and blood and marrow transplant are phrases that can be used interchangeably, which can be confusing for patients. For this video, we'll use the term stem cell transplant. There are two different types of transplants, autologous and allogeneic. In an autologous transplant, you are your own donor. Your own stem cells are collected and stored for reinfusion later. Diseases typically treated with autologous stem cell transplant are lymphoma, multiple myeloma, and some solid tumors such as testicular cancer. In an allogeneic transplant, you receive someone else's stem cells. The donor can be a relative or an unrelated donor. Allogeneic transplants are typically used to treat leukemias, myelodysplastic syndrome, and aplastic anemia.
All inpatient cancer services, including stem cell transplants, are provided at Barnes-Jewish Hospital in Parkview Tower, a state-of-the-art facility with an attached parking garage on the north side of the hospital campus. A family lounge and scenic respite areas are available to guests of patients. A patient and guest relations department can assist with travel and transportation arrangements, lodging, activities, and interpreter services. Parkview Tower has 3 floors called units, dedicated to stem cell transplant patients. They are the 8800, 9800, and 10800 units, each with 32 beds. The units are designed to make the stay as comfortable as possible for patients and families. Each of the 96 private rooms is equipped with a HEPA filtration system and state-of-the-art monitoring equipment. Transplant units also are designed to minimize the risk of infections, a major concern for patients undergoing stem cell transplants. Patients at Siteman Cancer Center also benefit from the expertise of Washington University researchers who are recognized around the globe for improving stem cell transplants. The program receives a large amount of research funding each year.
At Siteman, we have several financial coordinators to help you through this process. Our goal as financial coordinators is to ensure we provide accurate financial information to our patients and their families in a compassionate and tactful manner. Here at Siteman, we are huge patient advocates. We work cooperatively with all members of our transplant team to ensure the best possible outcomes for our patients. As stem cell transplant financial coordinators, we make ourselves available to our patients who have any questions concerning their health insurance and how it relates to their transplant experience. If there are insurance disparities or lack of insurance, our financial coordinators work closely with our Siteman financial counselors who can assist with financial assistance for qualified individuals. Our financial coordinators are continuously educating themselves on the latest insurance plans and coverage in order to educate and assist our patients with confidence. From the moment of a patient's initial consult to the moment the patient is admitted for transplant, we are working hard to ease the stress of financial concern. We are here to help and guide you through this process.
Transplant coordinators are experienced stem cell transplant nurses who practice in the outpatient setting. We work with you and your physicians to make sure your needs are met and that there is ongoing coordinated care during each phase of treatment in the stem cell transplant process. You will be assigned an outpatient nursing team during your first office visit. They will follow you through the transplant process and be your primary contact when you are not in the hospital. The outpatient nursing team will provide orientation, education, assessment of your condition, and supportive care.
We realize getting a stem cell transplant is a difficult decision, but once you've made the decision, please realize that we'll be with you every step of the way. Siteman Cancer Center is one of the top stem cell transplant centers in the nation, and our goal is to get you through the tough times and back to your normal life as quickly as possible. The process of allotransplant begins at diagnosis, so once we figure out kind of your outcomes and your age and comorbidities, we determine if you're a suitable candidate for transplant. So we'll speak to you early in the process to get all this testing done to figure out what's best for you based off of your quality of life preferences as well as how you are medically, and then making sure that we can start early in the process so we can move to transplant as quickly as possible rather than delaying anything unnecessarily, because the search has to happen pretty early on in the process as well.
After it's been determined that you need an allogeneic transplant, the first thing we must do is find you a matched donor. My job is to use your human leukocyte antigen testing, or we just shorten it and call it HLA testing. We use this to help find a donor. We usually look at 10 markers. First, we go to your family. We would like to be able to look at your brothers and your sisters. Sometimes we look at your mom and your dad or your children. We want to see who matches the best, who matches closest to all 10 of those antigen pairs that we're looking at. My job is to call your family and talk to them about the process, ask them if they'd be interested in being tested. I help them set up their appointments. Usually it involves a blood draw, and then we send them off to do that. It takes a couple weeks to get the results back. Once the results are back, I call them and I explain how they match and just verify that they're okay still being a donor for you. If one of your family members is not an appropriate match for you, we do have other options. Siteman Cancer Center is a member of the National Marrow Donor Program, and it is the largest registry in the world. Once it is decided that one of your family members is not an appropriate match, we will go to this registry and search for you. You'll sign a consent. This consent gives us permission to share your information with them, and we will use that to look at a registry with many, many people on it. Once we pick a few people, we'll bring them in for extra typing just to verify that the information we have is correct and they really are a match for you. Once I know all this, I will share this information with your medical team, and then your physician will make a decision based on that as to who the most appropriate donor for you would be. It is not a quick process. It can take a while. Based on diagnosis, we will start typing your family and looking for a donor on basically day one. This process can take a couple of months sometimes, and we would rather be ready up front so that when and if you need to go, we're ready. Another really important thing to think about is we all think about cost, and most insurance will cover this, but the National Marrow Donor Program does have assistance to help that will help cover the cost of finding a donor, sometimes completely, and sometimes it'll cover almost all of it, depending on your insurance and how many people we need to type.
So we usually describe it as similar to dialysis. You may have seen a pheresis machine if you've ever donated blood. That's how they also collect platelets. They connect you to 2 IVs, usually through your arms if possible. One will be drawing the blood out, and one will be returning the blood to you after the machine processes everything that it needs. There's a set goal, so usually for a donor, it's maybe 1 or 2 days of collection peripherally. We usually anticipate it takes about 4 to 6 hours of being in the pheresis chair, so be prepared to spend that time kind of stuck in a chair.
Your preparative regimen, or sometimes we also call it your conditioning regimen, is the therapy you receive when you're admitted to the hospital for your transplant. The preparative regimen's purpose is to clear out your bone marrow to make room for the stem cells you're going to receive. It also serves a purpose of protecting you from rejection issues after transplant, and also to treat any residual disease that might be still floating around. The side effects differ from person to person. Some pretty consistent side effects we see across the board are issues with fatigue, nausea, as well as low blood counts. Because we are clearing out your bone marrow, you are going to go through some times of having low blood counts and be at high risk for infection. So it's very likely you'll get IV antibiotics during your transplant stay. You'll also be supported with blood products. With the preparative regimen, the way we kind of count things down is the day you're admitted it's kind of like a countdown. We call it either day -7 or -5. It depends on how many days your chemotherapy is, or radiation too. So we count down day -5, 4, 3, 2, 1. 1 is typically a rest day, and then day 0 is your transplant day.
So on day 0, the infusion will happen depending on when the cells are ready. So after they're processed by our lab, they'll come up to your room, fresh usually. They'll give you some medications to prevent nausea and sometimes reactions. And then the infusion itself is actually similar to a platelet infusion, where they just infuse it over a set amount of time, and they'll be monitoring you pretty closely before and after the transfusion process. Usually with the allo stem cells, they're fresh, so we don't have too many side effects other than the possibility of an infusion reaction. So the days after transplant, as your stem cells are growing from almost the infant state to full-fledged cells in your body, the white cells, the red cells, and the platelets, it's going to take time for your body to build those up. So you're going to notice that your blood counts are going to drop to 0 after the chemotherapy. You'll have the chemotherapy side effects of nausea, vomiting, diarrhea that you can anticipate, and fatigue. So it's really important for our patients to stay out of the bed as much as possible to combat that fatigue, and then stay hydrated, and we'll be watching your counts and monitoring you for any fevers because you're going to be at very high risk for an infection. You really have no immune system for the first week or 2 after a stem cell transplant is infused. So because of that, people and their infections can turn really quickly. We have to make sure that you don't get really sick. So if you notice you have any fevers, chills, any of those symptoms, the nurse needs to know right away, because you're going to need antibiotics. You'll also be on antivirals, antifungals. We'll be supporting you basically as if you had no immune system for the first 2 weeks until you start building up those stem cells. Early on after transplant, patients may notice skin problems as well. Usually a skin rash is the first symptom of acute GVHD, which is graft-versus-host disease. So any symptoms like that, the team will want to know. They'll be looking in your mouth as well, monitoring any symptoms in your eyes, your stool, your urine. They'll be watching basically every aspect of your body.
We have a chaplain services, we have a social work that can give you any kind of references or contacts that you need. We have registered dietitians for each floor that can talk to you about special questions that you might have about diet and how to move forward. If you don't speak English, we do encourage you to have a family member. However, for any medical issues or medical conversations that need to take place, we'll have a professional translator there to do that with you. Each floor has an exercise room. It has exercise stationary bike. We encourage walking, even walking outside of your room with a mask. You'll have a map of the floor that defines how much is a mile. We have people that can walk with you if they need to. Physical therapy can give you exercises you could do in bed if you can't walk. All floors have a shared refrigerator that you could use for snacks. You can keep snacks in your rooms On the second floor, we have a lounge that family members can use. It's got several washers and dryers. It's got a shower. It's a place where they can go maybe if the patient is having a sleep day, instead of trying to sit in the room and be real quiet, they could go down to the second floor. There is a concierge person there, and it gives them a lot of options. We do ask that they shower down there. They do supply towels and washcloths. We also have computers available to stay in touch. They can be checked out by the day, so you can ask your nurses for how to contact and check out a computer. Because it's such a huge time in people's life, and it's because things come up that have never come up before, Siteman has an oncology psychology department that is more than willing to meet with any of our patients, and is open also, I think, to speak with patients' families. You can let your nurse know, you can get the phone number from anyone, you can call them directly, or we can call the referral down for you if you prefer. They'll stay in touch a lot of times even after your discharge from your transplant if you need to touch base with them when you're here for an appointment. For an allogeneic transplant, with day 0 being your day of getting your cells back, your stay generally tends to be day 16 into 20, depending on how your body does. Individuals progress at different rates. You need to be able to drink at least 1 liter. You need to be able to walk. You need to be eating small amounts of food without constant anti-nausea medicine. We need to know if the diarrhea is continuing, because it's not going to improve and it'll even get worse on its own. No fevers can be present for at least 24 to 48 hours. Graft versus host disease, the diarrhea, and the rash, if you start to have a rash, become very essential pieces of information and need to be brought up before you could go home. Your absolute neutrophil count recovers. It needs to be 1,500 for 2 days. So it's a combination of a lot of factors. It's not just blood counts coming together. Nutrition is such a big thing, and there's so many things out on the internet. We tend to do evidence-based practice here. Our registered dietitians are college educated and very adept at what oncology patients need to heal, the types of things they need. If you would like to see a dietitian, they do try to meet with all of our transplant patients. If you want to see one at any time after or before that, you can let us know. We'll have the dietitian come in and see you during their course of their day.
The chemotherapy and radiation will have effects on reproduction as well as sexual function. It is safe to have intercourse with your partner when you feel ready for that. We do want to be notified if you have any concerns or questions, because there could be some risk for infection or bleeding. If you have concerns about reproduction, just let us know and we can talk about options such as IVF or in vitro fertilization or sperm banking and provide a referral for you to the fertility department.
Discharge for the allogeneic transplants, again, you're going to come back 3 to 5 business days for an appointment. You may have labs between when you get out and that first time you see them. Twice a week you'll have blood work. It depends on how your blood counts are recovered, what your drug levels are, as to what labs they actually do. Always ask what labs you're getting and get involved. Plan on 100 days after your discharge from your allogeneic transplant. The graft versus host, the issues with digestion, all the things that can come up are not things that a local hospital is going to be aware. They're not going to be aware of how quickly you could get an infection that could be critical because your immune system is so suppressed for a while. Your doctors can talk to you about when, as you get further out from the transplant, they're comfortable and feel like you're ready to go back to a more than 2-hour wait distance.
Siteman has many programs available for patients. Some are in person and some are online. There's also several programs in patients' communities too. We also have a survivorship program too for patients after allogeneic stem cell transplants. That program starts about 1 year post-transplant, and that's really when you come to see us nurse practitioners, and we're monitoring for late effects, that you're dealing with post-transplant, as well as maximizing, quality of life issues and discussing those and staying on top of things.
Due to advancements in cancer care, patients are living longer. We understand that post-transplant you may have many different challenges, including functional, medical, and psychological challenges. For this reason, we have implemented a survivorship care program. This is integrated into your routine follow-up. The goal of the Survivorship Care Program is to improve the experience and outcomes for stem cell transplant patients and their caregivers by providing high-quality clinical survivorship care.
Whether you're an autologous transplant recipient or an allogeneic recipient, we recommend that you have a caregiver. The caregiver is not someone who's going to be doing your bathing or your actual physical care. Generally, there's someone that helps you. You'll have a fog frequently, trouble focusing, so they can help if you have a lot of medications. They can fill up medicine boxes for you. They can attend doctor's appointments with you to make sure that both of you are hearing the doctor saying the same thing. You can't drive in the initial period. When that period ends is up to you and your outpatient doctor.
A caregiver can be anyone that a patient identifies that is a reliable person in their life that can make a commitment to be there for the patient, that understands the needs that the patient has. As mentioned, the appointments, doctor visits, medications, and those things. Siteman Cancer Center provides support for caregivers. We understand that this can be a very big task for caregivers and it can be very stressful. You know, they have a lot of stuff going on in their own lives. We understand that they want to help their family or loved one, but they may need additional resources themselves.
For all those reasons, a caretaker is needed, available to motivate you, to remind you to have a little something to eat or bring it to your side every 2 hours.
Thank you for taking the time to learn more about the stem cell transplant program at Siteman Cancer Center. We hope this video has made you more familiar and comfortable with the journey you're about to undergo.
We're grateful that you've placed your trust in Siteman Cancer Center in your battle against cancer. We understand that things may be frightening and unpredictable for a while. Our goal here at Siteman is to help you get through your treatment and back to your life as soon as possible. You're not alone, and we're here to help.
Thank you! Thank you so much for choosing us as your transplant center.
Thank you for allowing us to provide you with the exceptional care that you deserve.
Thank you for trusting Siteman Cancer Center with your care.
Thank you! Thank you so much for choosing us to be your caregivers. It's an honor to be able to care for you during this time.
Thank you for putting your trust in us.
Thank you for putting your trust in us with your care.
Thank you!